Hello everybody once again, and it's me Andy with another Brain Attack music video. We know, don't we, that we get a lot of medical advice from medical professionals who haven't had a stroke. So what can they know about it? And I wondered what would happen if we had a medical professional who'd had years of experience of dealing with stroke patients, maybe being in charge of rehabilitating stroke patients who then had a stroke. Well, we don't have to wonder because it has happened. There's a book about it, and the person concerned is actually somebody that I know because he was in charge of my rehabilitation. So let's look at his story. The gentleman concerned is Professor Udo Kishka, who I first met in probably about, I would think August or September of 2013. So Udo was a consultant neurologist in neuro rehabilitation, and bear in mind he's a professor. And he worked at the OCE, the Oxford Centre for Enablement. And when I was discharged from hospital at the John Radcliffe Hospital in Oxford, I had a referral to the OCE for clinical psychology, occupational therapy and physiotherapy. And these three teams reported into Professor Kishka. So a fantastic setup at the OCE, brilliant staff, and Professor Kishka plainly had his finger on the pulse of what was necessary. He was an extremely switched on guy, and the minute I met him, this is one of those people that you meet and you think, yeah, actually I like this guy. He knows what he's doing, he knows what he's talking about, and he put stuff into plain English to the extent that he was explaining to me about my stroke, and he said, look Andy, what you've got to realise is that you've had your head kicked in from the inside. And that always stuck with me because the more I learned about stroke and the effects of stroke, the more I realised that, yeah, actually, we've all had our heads kicked in from the inside. And I think when we put it in those terms, you've had your head kicked in, yet we'd expect somebody who'd had their head kicked in literally to be covered in bruises and cuts and abrasions. They wouldn't be looking as if they hadn't had anything wrong with them. But you've had your head kicked in from the inside. Yeah, that kind of summed it all up really. So anyway, so I met Professor Kishka a few times at various stages of my rehabilitation, and really top guy. I was subsequently discharged from the OCE. We moved from Oxford up here into rural Scotland, and kind of he popped into my thoughts every now and again, but that was it. Until I came across an article about him saying that he'd had a stroke, and this was in 2016, and he was at the age of 62. Subsequently, he's written a book along with his wife, Dr. Helen Kennelly, and it's called, I've got it written down here, it's called Surviving Stroke, the Story of a Neurologist and His Family, and it's published by Robinson. It's available on Amazon. You can either buy the paperback or you can, I think the Kindle is $2.99, I think, something like that. Rather than read out anything from the book which might have copyright issues, I don't know, I don't want to go there, I couldn't deal with the stress and the anxiety. He published an article online, and I'm going to read you some bits from that article, so it's all public domain stuff, so I don't get myself into any trouble. And I just read out some of the things that he said. So you've got to bear in mind, this is a guy who's been working with stroke patients for most of his adult life. He's a professor, he's a neuro consultant in neuro rehabilitation. So he's one of our experts, basically. So I'll just read out some of the things that he's written. Here we go. I had considered myself a stroke specialist, but soon realised how little I knew. I'll say that again. I had considered myself a stroke specialist, but soon realised how little I knew. So just to give a bit of background on this, he said, running for a train, I experienced pain in the right side of my head and mild weakness and sensory loss in my left limbs. I thought I'd had a stroke, but I was remarkably calm. It was late and my instinct was just to get home, you can identify with that, where I went into my study. In the morning, I found myself on the floor, half blind, half paralysed and terrified. Scans showed a large intercerebral hemorrhage in the area of my right basal ganglia. My symptoms could be explained by the damage to my brain. My medical world was in order, something to hold on to. So that's the background for it. Running for a train and the stroke specialist has a stroke. Some observations from the piece here. My left arm no longer felt my own, and I confused it with my surroundings. Once I thought that I'd lifted it, but the moving arm actually belonged to my physiotherapist. On another occasion, I mistook a long cushion for my arm, momentarily thinking that my limb was lying on the floor. Hemianopia was a revelation. A bit later on he says, I also suffered from flashbacks to the worst memories associated with my stroke. This is a few weeks on. It made me realise that I should have asked my patients more about their anxieties. I now wish I had asked my patients what exactly they'd experienced, but I think that my professional knowledge had prevented me. Knowing medical terms gave me confidence that I understood, but I understood the diagnoses, not patient experiences. And I get that because I've said before in other videos, until you've been through this experience, until you've had a stroke, you can't possibly know what a stroke's like. And I think that applies to any medical condition. I've never had a broken leg. I can't imagine what a broken leg must be like. In order for me to get an idea about what a broken leg must be like, I've got to have a broken leg. And I think in order for anyone to understand fully what a stroke is like, they've got to experience a stroke. But of course, there are strokes and there are strokes. So in order for you guys to experience what I experienced, you've got to have the same type of stroke that I had, a cerebellar stroke. In order for me to experience the type of stroke you had, or Professor Kishka had, I've got to have that type of stroke. So I totally understand that. So he then says, instead of exploring what they were going through, his patients, I explained symptoms, prognoses, and treatment options. I genuinely thought that in doing that, I could offer most help quickly and reassure both patients and families. So it's a bit like somebody reverting to kind of data, academia. It's facts. And I think this is why we get told things like, oh, you don't get any better after a year, oh, you don't get any better after 2 years, because this is how they've been trained. They don't generally tend to see us much longer than for a year or 2 years, and the assumption is, well, that's it, I've signed them off after 18 months, they're not going to get any better. So he then continues, I'd also had advised patients in the past that recovery would be a series of ups and downs, but my experience was of many regressions. Infection, low blood pressure, and mental stress frequently set back my progress and demoralised both me and my loved ones. I think that I could have better prepared patients and families for the many difficulties that arise in the long recovery after stroke. I was transferred to the rehabilitation unit where I had been a consultant. So Professor Kishka ends up as a patient at the Oxford Centre for Enablement that he effectively ran. How ironic is that? I had complex needs and was unable to do the simplest things such as hold my head upright or sit. I required hoists for transfers between bed and wheelchair. Such neediness was more terrifying than I would ever have expected. Yeah, because until we're in that situation, we just don't know how we're going to react. Some people go, yeah, okay, this is it, this is what I've got to deal with. Other people just go, wah! And everybody is most somewhere in between those two extremes of being almost clinically psychotic about it. Well, this is what it is, I've got to deal with it, get on with it, yep, okay, fine. No emotion whatsoever. The other extreme, just 100% emotion. Panic, I don't know what to do, floods of tears, etc., etc. Most of us are somewhere between those two extremes, I guess. I don't know, I guess. So he then talks a bit more about his experiences with rehabilitation, and he gets the odd home visits. And this is what he says about that. Towards discharge, I had brief home visits that, disappointingly, I slept through. I now see that these are an active and exhausting part of rehabilitation, and in retrospect, we had expected too much from those initial visits home. On discharge, I still had very limited independence. This took a predictable toll on my family, and my period of grieving for my lost life began. We've been there, haven't we? Again, I wish that I devoted more time to considering the impact of this transition for my patients. Yeah, that transition I'm sure we've been through between discharge from wherever we've been, hospital, rehabilitation centre, care home, but we've been discharged and we're now back at home. And it's that safety net that we've had, and kind of the longer we've been in a rehabilitation, hospital, care home environment, I think the harder it is to transition to life at home, because it's like you've got all this help and then all of a sudden not much at all, if anything. And it's like, how am I going to cope? I haven't got all the support that I have had for the past few weeks, few months, whatever. So he says, I now fully appreciate a well-structured discharge report, one that is more than just a summary of disability and limitations, with some pragmatic guidance on adaptations for everyday living. Yeah, we've all seen those discharge reports, haven't we, with all the medical terminology. This is what happened, this is what we've done, bye. Nothing really, certainly on my discharge report anyway, nothing in there about, well, this is what happens thereafter. It's basically, you're alive now, you're breathing, yeah, you've got a few holes in your head, mate, we've done the operation, here's some meds, bye, back at you. So he concludes by saying, almost 3 years on, I look back and reflect on the worst thing about my stroke. It was the helplessness. I'd been shocked by the profound distress, hopelessness, embarrassment, even shame of its impact, threatening my very sense of being. Yeah. Again, coming back to what I said at the top of the video, you've got to go through this to understand it. Patients need affirming care that goes beyond goal attainment. Carers need to preserve patient dignity. cultivate compassionate motivation, and understand what the person actually experiences. Yeah, but again, that sounds great, and I understand what he's saying, but it's so hard for a carer who's maybe visiting 10 different houses a day. One of them's had a stroke, one's had a heart attack, one's got COPD. They can't have experience all of those health issues themselves. They can't really, you can't really do that. And in an ideal world, yeah, but it's not really going to happen. So without this care, helplessness could so easily have robbed me of my sense of self and of purpose, a necessary foundation for rehabilitation and integral to having a life worth living. So there you go. I would strongly recommend, I'm going to do it because I haven't read it, but knowing Udo as I do, albeit very briefly, and reading this makes me want to read more about the book and his experiences in more detail, because I think it's fine me doing a video like this, you watching it and learning from my experiences, but this is a guy with 30 or 40 years experience of treating stroke patients, managing psychologists, managing occupational therapists, managing physiotherapists, who ends up himself at the age of 62 having a stroke and being rehabilitated in the unit where he was a consultant and he's a professor. So this is not just, somebody down the ladder. This is somebody at the top of the tree. Anyhow, just some thoughts that I thought would be interesting to share with you there. If you'd like to make comments on this video, if there's anything here that's inspired you or any questions that you have, please leave some questions in the comments section if you're watching this on YouTube, or on Facebook if you're watching on Facebook. And take care, look after yourselves, and we'll see you soon. Bye for now.